Welcome, everyone, to the OphthoKnight quiz show, the ultimate interactive challenge for ophthalmologists from around the world. Test your knowledge, compete, and win. Every week, we go live with a fast-paced, high-energy ophthalmology quiz. You'll face real clinical scenarios, rapid spot diagnoses, and investigative decision-making, putting your practical ophthalmology skills to the ultimate test. Compete against ophthalmologists worldwide in a quiz that's fast, challenging, and fully interactive. Here's how it works. Answer in the comments using only the number 1, 2, 3, or 4. Only one answer per question counts. Multiple submissions will be disqualified. Answer quickly. Don't wait for the full question to be read. The winner is the one with the most correct and fastest answers. Over the past weeks, hundreds of outstanding ophthalmologists have joined our quiz. Here are some of our brilliant winners. Look at those scores. Incredible work. And heartfelt congratulations to our champions. Maybe next time, it'll be you. Winners also receive a symbolic gift, but the real reward is sharpening your ophthalmology skills and competing with the very best. Are you ready to take the challenge? Subscribe to OphthoKnight, join the live quiz, and maybe your name will be the next on our winner's board. We go live every Friday at 11:30 p.m. Cairo time. To join, simply subscribe, turn on notifications, and be ready when the quiz begins. All you need is your knowledge and your speed. Join us live and see if you have what it takes to become the next OphthoKnight champion.
Welcome to our live trivia show. Get ready to test your knowledge in the fascinating world of ophthalmology, the science of eyes, vision, and everything in between. From retina to cornea, optic nerve to ocular diseases, we're diving deep into the anatomy, physiology, and treatments that keep our vision sharp. There will be 25 questions. Each has 4 answer options, only one is correct. The faster you answer, the more points you earn. To play, comment the number or type the full correct answer. Let's begin. Here's your first question. Let's kick things off with optics. A convex mirror produces what type of image? 1. Virtual, inverted, magnified. 2. Virtual, erect, minified. 3. Real, inverted, minified. 4. Real, erect, magnified. Think carefully and comment your answer now. Convex mirrors are often used in vehicles for wider rear views. Correct answer, virtual, erect, minified. 13 players got it right. Shout out to our top players. Here comes question 2. Let's test your pharmacology knowledge. Which antibiotic results in the highest intravitreal concentration when administered orally? 1. Penicillin. 2. Clindamycin. 3. Ciprofloxacin. 4. Bactrim. Think fast, choose wisely, and lock in your answers now. Fun fact, intravitreal means inside the eye's vitreous humor. Pretty cool, right? Correct answer is ciprofloxacin. Well done. 9 of 11 players answered correctly. Shout out to @Mohammed1418, great job. Also at Imam Mohammed CK5WC, you nailed it. At Dr. Shima E.El Arabi, strong performance again. At Mahmoud Mustafa Z2M, you're on fire. Time for question 3, neuroanatomy fans, this one's for you. Which cranial nerve is most prone to injury in the cavernous sinus? 1. Cranial nerve 6. 2. Cranial nerve 5. 3. Cranial nerve 4. 4. Cranial nerve 3. Picture the cavernous sinus, so many nerves, so little space. Fun fact, the cavernous sinus contains nerves controlling eye movement and sensation. Correct answer is cranial nerve 6. All 9 players got it right. At Sarah Helshahawi 5316, you crushed it again. At Dr. Shima E.El Arabi, flawless streak continues strong. At Omnia Magdi or 7T, sharp and steady work. At Amir Eid C7J, great job there too. Here comes question 4, eyes on the prize, everyone. Among congenital infections that affect the eye, which one is most common? 1. Toxoplasmosis. 2. Rubella. 3. HSV. 4. CMV. Tiny pathogens, big impact. Choose wisely and lock in your answer now. Fun fact, CMV can cause chorioretinitis in newborns with congenital infection. Correct answer is congenital CMV infection. Only 3 of 8 answered correctly. At Mohammed at 1418, nicely done on that. At Mahmoud Mustafa Z2M, sharp eye, great job. At Amir Eid C7J, you're on fire today. Alright, question number 5 coming your way now. Which of these is least common in childhood pertussis? 1. Rhabdomyosarcoma. 2. Mucocele. 3. Lymphangioma. 4. Cavernous hemangioma. Think carefully, rare doesn't mean impossible. Lock in your answers now. Fun fact, rhabdomyosarcoma is the most common orbital malignancy in children. Correct answer is cavernous hemangioma, everyone. 0 of 3 players answered correctly. Tough one, but keep pushing forward. Here comes question 6. Focus up, everyone. What's the most common cause of vitreous hemorrhage in children? 1. Shaken baby syndrome. 2. ROP. 3. FEVR. 4. Coats disease. Think fast, eyes tell stories, even silent ones. Lock answers now. Fun fact, retinopathy of prematurity primarily affects premature infants developing retinal vessels. Correct answer is shaken baby syndrome. 0 of 0 players answered correctly. No worries, more questions still ahead. Question 7 coming your way. Get ready to focus. Where does congenital lacrimal obstruction usually occur? 1. Valve of Rosenmuller. 2. Valve of Hassner. 3. Lacrimal sac. 4. Common canaliculus. Eyes watering? Maybe not from emotion. Lock in your answers now. Fun fact, newborns often have watery eyes due to blocked tear ducts. Correct answer is valve of Hassner. 0 of 0 players answered correctly. Let's keep going, more chances ahead. Question 8 is here. Let's test your surgical sequence knowledge. Staged surgery for severe thyroid-related ophthalmopathy is best done in what order? 1. Strabismus, decompression, lid repair. 2. Lid repair, decompression, strabismus. 3. Decompression, strabismus, lid repair. 4. Decompression, lid repair, strabismus. Think like a surgeon, steady hands, sharp mind. Lock in answers now. Fun fact, the thyroid can affect eye muscles and orbital tissues significantly. Correct answer, decompression, strabismus, lid repair. 0 of 0 players answered correctly. Nobody got it right, keep trying. Here comes question 9, get those brain cells firing. Why does the contralateral lid fall when a ptotic lid lifts? 1. Relaxation of the frontalis muscle. 2. Inhibition of Muller's muscle. 3. Sherrington's law. 4. Herring's law. Think neuroanatomy and reflexes, lock in your answers now. Fun fact, ptosis can be congenital or acquired later in life. Correct answer is Herring's Law. 0 of 0 players answered correctly. No one got it right, unlucky. Here comes question 10, let's keep that momentum going strong. A conjunctival map biopsy is typically used for which malignancy? 1. Squamous cell carcinoma. 2. Sebaceous cell carcinoma. 3. Malignant melanoma. 4. Basal cell carcinoma. Think carefully, ocular oncology isn't just eye-opening, it's fascinating. Sebaceous carcinoma often mimics benign conditions, making diagnosis tricky and delayed. Correct answer, sebaceous cell carcinoma. 0 of 0 players answered correctly. No one got it right, wow. Question 11, let's keep those brains hydrated and focused. Even spreading of the tear film depends most on which factor? 1. Mucin. 2. Lipid. 3. Epithelium. 4. Aqueous. Eyes need balance. What's the key player in tear distribution? Tear film has 3 layers, mucin, aqueous, and lipid, each essential. Correct answer, mucin. 0 of 0 players answered correctly. Nobody nailed it this round. Question 12, let's zoom in on the cornea. A satellite infiltrate with feathery edges is most characteristic of a corneal ulcer caused by 1. Pseudomonas. 2. Microsporidia. 3. Fusarium. 4. Acanthamoeba. Think carefully, those feathery edges are a big clue. Fungal corneal ulcers often show feathery edges and satellite lesions, classic signs. Correct answer, Fusarium. 0 of 0 players got it. No correct answers this time. Question 13, let's talk parasites and puzzling infections. Larvae cause all of the following infections except 1. Onchocerciasis. 2. Diffuse unilateral subacute neuroretinitis. 3. Cysticercosis. 4. Cat scratch disease. Think fast, only one isn't larva related. Onchocerciasis is also known as river blindness, spread by blackfly bites. Correct answer, cat scratch disease. 0 of 0 players answered correctly. No correct answers this round. Question 14. Time to focus your vision on this one. Which of the following is not a cause of leukocoria? 1. Toxocariasis. 2. Hyperplastic primary vitreous. 3. Eels disease. 4. Coats disease. Trust your instincts. Pick the odd one out. Leukocoria means white pupil and can signal serious eye conditions. Correct answer, Eels disease. 0 of 0 players answered correctly. No correct answers this time. Question 15. Let's test your thyroid eye disease knowledge. Which is the best activity indicator in thyroid eye disease? 1. Upper lid edema. 2. Reduced color vision. 3. Pain. 4. Diplopia. Think carefully, your next point might depend on this. Thyroid eye disease often affects muscles controlling eye movement and eyelid position. Correct answer, upper lid edema. 0 of 0 players answered correctly. No one got it right. Question 16. Time to zoom into eye anatomy. Bruch's membrane is a 1. Trilaminar structure. 2. Pentalaminar structure. 3. Hexalaminar structure. 4. Bilaminar structure. Take a guess. Layers of knowledge might help here. Bruch's membrane lies between retina and choroid, supporting nutrient exchange. Correct answer, pentalaminar structure. 0 of 0 players answered correctly. No correct answers this round. Question 17. Let's talk corneal grafts and recurrence risks. Which of the following diseases has the highest risk of recurrence? 1. Reesbuckler dystrophy. 2. Macular dystrophy. 3. Lattice dystrophy. 4. Granular dystrophy. Think carefully, some corneal conditions love a comeback. Lattice dystrophy often appears in early life and affects corneal clarity. Correct answer, Reesbuckler dystrophy. 0 of 0 players answered correctly. No correct answers this time. Question 18. Time to zoom in on the lens capsule. At which location is the lens capsule thinnest? 1. Posterior capsule. 2. Equatorial capsule. 3. Anterior paracentral capsule. 4. Anterior capsule. Think anatomy, precision matters in every tiny layer. The lens capsule is thickest at the anterior central region. Correct answer, posterior capsule. 0 of 0 players answered correctly. No correct answers this round. Question 19. Let's talk Ehl's disease and its tricky traits. Which of the following is least characteristic of Ehl's disease? 1. Vitreous hemorrhage. 2. Vascular sheathing. 3. Neovascularization. 4. Macular edema. Eyes on the prize, choose the odd one out. Ehl's disease often affects young adults and causes retinal inflammation. Correct answer, macular edema. 0 of 0 players answered correctly. No correct answers this time. Question 20. Time to test your ocular oncology knowledge. The most common site of metastasis for choroidal melanoma is 1. Skin. 2. Lungs. 3. Liver. 4. Brain. Think fast. Where does it usually spread first? Choroidal melanoma spreads hematogenously, most often targeting internal organs like the liver. Correct answer, liver. 0 of 0 players answered correctly. No correct answers this round. Question 21. Let's talk age-related macular degeneration. In a patient with AMD, which type of drusen is most associated with development of CNV? 1. Soft. 2. Hard. 3. Calcific. 4. Basal laminar. Choose wisely, some drusen types are sneakier than they look. Drusen are yellow deposits under the retina, common in AMD progression. Correct answer, soft. 0 of 0 players got it. No correct answers this time. Question 22. Let's focus on pediatric eye diagnostics. The most useful diagnostic test in an infant with an oil droplet cataract is 1. Urine-reducing substances. 2. Urine amino acids. 3. Calcium. 4. Torch titers. Think carefully. Tiny clues can reveal big diagnoses. Oil droplet cataracts are often linked to metabolic disorders like galactosemia. Correct answer, urine-reducing substances. 0 of 0 players got it. No correct answers this round. Question 23. Let's talk ocular oncology, shall we? Which choroidal nevus feature suggests higher melanoma risk? 1. Tumor thickness of 1 mm. 2. Presence of drusen. 3. Absence of ultrasonographic hollowness. 4. Absence of halo. Eyes open, mind sharp, choose your answer carefully now. Choroidal nevi are found in about 5% of Caucasian adults. Correct answer, absence of halo. 0 of 0 players answered correctly. No one got it right. Question 24. Let's dive into ocular mysteries again. Which is not characteristic of MEWDS? 1. Flu-like illness. 2. Female preponderance. 3. Enlargement of the blind spot. 4. Bilaterality. Think carefully, MEWDS can be tricky to diagnose. MUDS often affects one eye and resolves without treatment. Correct answer, bilaterality, not typically seen. 0 of 0 players answered correctly. Nobody got this one right. Final question, let's finish strong, everyone. Paradoxical pupillary response does not occur in 1. Albinism. 2. Achromatopsia. 3. Leber's congenital amaurosis. 4. CSNB. Think fast, this one separates the pros from the pupils. Paradoxical pupils constrict in darkness, seen in some retinal disorders. Fascinating, right? Correct answer is albinism, surprisingly tricky. 0 of 0 players answered correctly. Nobody nailed this final question. That's a wrap on today's trivia challenge. No players joined, so no winners. Thanks for watching, see you next time.